Walking in a group is wonderful, absolutely wonderful. It's a good way to making life the best we can and have some fun.
My name's Tina Morrow. I'm the manager with Partnerships for Wellbeing who run the Step It Up Highland project.
And I'm Lynn Bannister. I'm the coordinator of the Step It Up Highland scheme.
We're going to talk a little bit about why we're here today. Could you perhaps tell us what a health walk is?
Absolutely. Really in Step It Up Highland here, we're trying to engage with people who perhaps otherwise wouldn't walk. So we've got a model of health walks that we offer across the Highlands. We've got around about 29-30 groups now.
We think Step It Up Highland's special, Lynn. Could you tell us why it is so special?
Absolutely. We're a mature project. We've been going for 12 years actually, and lots of our walkers and walk leaders have been with us all that time. So the length of the project really is one thing. The other thing is that we've got a model of walks which help people progress from step out, shorter walks for people perhaps less able, Step It Up Highland walks, our core walks for an hour, and Step It Up Further. There's been an initiative to stretch people who can manage up to 2 hours, so it's still a health walk.
So we've heard a little bit about what the walks are. Could you tell us how do we do it then?
It's very easy. People just really need to turn up. The walks are free, and people just need a comfortable pair of shoes really and some appropriate outer clothing.
So why do people walk with us?
Well, Tina, it's really interesting. I think generally it's for a whole host of reasons, but it can be to manage their physical health, making an active choice to look at their health and well-being, but it could be about social isolation. A lot of people in their communities can become quite isolated. So the whole range of human conditions really can be self-supported, I think, through regular health walks. Sometimes it's the whole raft of human experiences that, sort of limit people's lives, that can impact on their ability to get out and exercise. Walking in a group is a good way to often alleviate some of those situations.
Who leads the walks, Lynn?
Oh, that's a crucial point. We've got a fantastic band of volunteers. We've got about 120 now across the Highlands, wonderful people. They volunteer for a variety of reasons, and they just give so much to us. We're so grateful for their help. Generally have a walk leader at the front of the group and a walk leader at the back. That's a model that is well recognised across Scotland on health walks. But some of our groups are much bigger, and they'll have walk leaders dotted throughout the group.
We have a few who are elderly people and they're fairly frail, so we have to be careful, of course, the length and the type of walk that we undertake. And we have one or two who have depression, which is, you can't always tell. I mean, obviously if someone has a disability, you can see what's happening there. But with a mental problem, it's not that easy.
I spoke to a person who's suffering just early dementia, and I spoke to his wife the other day, and she says he's just got a difference in him. He comes home and says, I talk to somebody different every day.
And it's so nice for the carer, because they can go off and do their own thing and know that their partner is going to be chatting to people and being looked after, and that gives them such a break.
One of the young girls that came today lost her husband 6 weeks ago.
I guess our biggest successes have been, had a young lad who was extremely autistic, and he got really quite enthusiastic and into the walking, and his parents bought him walking boots and all the kit. And he really got a lot out of it, especially socialising afterwards, because he wasn't a very social person, but he could interact with people. He got friendly with us, and so he enjoyed his tea and his coffee and his cakes, as well as the walking.
I do lead walks with the Maggers group, and that's for people who've had an experience of cancer or know someone who's had cancer.
Hi, I'm Dan. I'm a health promotion specialist with NHS Highland. Enjoying being physically active is probably the single best thing that we can do for our health. And that applies to all of us, whatever our ability and whatever our fitness levels. If we can build up gradually at our own pace, then we can feel the health benefits for our physical health, for our mental health, for our mood and stress and anxiety, and also for our social health. The walks provided by Step It Up Highland are ideal for building up that pace and that level of activity that suits us. And we also get that support of having a led leader and people around us. So if we're looking to get the best from our health and enjoy being active, then for many people, walking can be the ideal thing. And a led walk by Step It Up Highland, in my book, hits all those targets.
Hi, I'm Nikki. I'm a cardiac rehab nurse from Raigmore Hospital. I also coordinate the cardiac rehab services in the Highlands. And we all love walking here because it helps our patients recover from different cardiac events. It's free, it's cheap, it gives great peer support when they go out with a walking group. It's fun and it's sociable, and that's all the things that we want for our patients when they leave our care here at Raigmore.
My key message for being physically active: enjoy.
So that's us. That's a snapshot really of one of our groups, Strathpeffer Group.